During pregnancy, there's a difference in how our metabolism functions. So for some people, they could have pre-diabetic predisposition before pregnancy, and then it shows up in pregnancy. There's other people that we feel that it's just the changes of pregnancy that causes the body not to be able to metabolize the carbohydrates and sugar like it should, and so therefore presents a diabetes situation that happens just during pregnancy. Women who have gestational diabetes should be followed after pregnancy every 2 or 3 years with testing, because they do have a higher tendency than others to become diabetic later in life. And of course, counseling and prevention of trying to eat healthy and clean instead of keeping a lot of carbohydrates and sweets going in the diet, it would be the aim also, help them. It's tested by giving a dose of glucola, which is a concentrated measured amount of sugar, and then 1 hour later getting a blood test to see how did the body handle that 50 grams of glucola. If it's above a level, the places vary, whether it's 130 or 135 is what the level's used, then it's recommended to get the diagnostic test, because really the 1 hour test is only screening. The diagnostic test is a 3-hour test where you have 100 grams of the glucola, and you get a fasting blood test, a 1 hour, a 2 hour, and a 3 hour, so it gives a chance to see how does your body metabolize it over a 3-hour period of time. If there are more than 2 abnormal results, 2 or more abnormal results in those levels, then that's a condition of gestational diabetes. I think that's more even how do you prevent diabetes in general. Healthy lifestyle, of healthy, clean eating. In our American diet, there's lots of carbs, carbohydrates, and lots of the sugar and everything, bread, milk, everything. So really trying to reduce the amount of that, because that can overstimulate our bodies and our pancreas and the insulin production. And exercise, of course, is important. First line of management would be diet control, getting rid of those unhealthy carbohydrates, watching what's happening, being aware of what's happening with your fasting blood sugars in your 1 hour or your 2 hour after you eat. And if you're able to keep your numbers in range by adjusting your diet, then that's called diet controlled, and you don't need medication. But if you can't keep those, and sometimes you can be eating perfect and still not able to keep your sugars where they need to be, then that would be a medical consult and a medical management to move on to either oral medication or insulin.